ODB Audits, the inside scoop from an ODB auditor. MK Law took questions from pharmacists and sat down with an ODB auditor and asked him to give us the inside scoop, and he did. You want to know more? Keep watching. How does a bad ODB audit at one store affect other stores of multi-store owners? Would that trigger an audit at other stores as well? First, it's important to distinguish between existing pharmacies with an existing ODB number versus new pharmacies applying for a new ODB number. If there is a bad audit at one store and the shareholder director own other stores, the impact of the ODB audit on other pharmacies will depend on the magnitude of the violations of the store being audited. It will also depend on the discretion of the ODB auditor and the report to their manager. If there's a particular pattern, for example, compounds being billed incorrectly at one store, it's likely to be occurring at other stores of the same owner director. So ODB may decide to do a claims review for other stores with the same owner director. If fraud is uncovered, then it is likely that ODB will do a claims review for other pharmacies involving the same owner director. And does it matter if the owner is just a shareholder or also a director officer at the other stores? Some multi-store owners are removing themselves as directors from many of their stores to protect the stores in case of an ODB audit. Does that make a difference? As for removing oneself as director, it doesn't necessarily protect the other pharmacies if the pharmacist owns the shares in their name personally. Although ODB inspectors don't have immediate access to the HNS agreement, they can easily request it from ODB administration, which will show all the shareholders and the directors. So if a shareholder owns the shares personally, that information will be easily retrievable. If a shareholder owns shares under a holding company or a shell corporation, then their name may not be immediately attached to the pharmacy, but there are still ways ODB can determine if they are involved with the ownership. What about new pharmacies? How does a bad ODB audit affect a new pharmacy applying for an ODB number if one of the shareholders of the new pharmacy is blacklisted by ODB? If you do partner up with a person who is blacklisted by ODB, whether you are partnering up with this person and that person is a shareholder, officer, director, designated manager, it can negatively affect the new pharmacy and your chances of getting ODB numbers with ODB. ODB, according to their HNS agreement, Section 11, they do not want you to associate in any way with a person who is blacklisted. And so just be careful, and it doesn't matter whether that person is a shareholder, officer, director, or designated manager. ODB does not want any association with any person who is blacklisted. If you do associate with such a person, it may negatively impact your chances of getting an ODB number. Can therapeutic notes or limited use notes leave a pharmacy subject to clawbacks? For example, before Ozempic became limited use, the therapeutic notes on Ozempic said that it was covered for treatment of type 2 diabetes in combination with metformin. If the patient isn't on metformin or hasn't tried metformin, does that mean the pharmacy can be clawed back for Ozempic? That's a gray area and is subject to the discretion of the auditor. In general, therapeutic notes are intended as guidelines for prescribers. LU notes are more important than therapeutic notes. Not following the LU notes will result in a clawback. Pharmacies may be clawed back based on therapeutic notes, so it is a good idea to always document patient eligibility. However, if a pharmacy is clawed back based on therapeutic notes, it may be easier to appeal that portion of the clawback. Is there a statute of limitation on how far back ODB can go? In other words, is there a time frame limit as to how far back ODB can claw back? ODB auditors usually look at the most recent 2 years in an inspection. However, auditors can go as far back as pharmacists are required to keep records, and in some cases, they do. When ODB is auditing frequent dispensing forms after UN codes are used, are they only looking at the most recent current frequent dispensing form, or do they look at previous year's forms as well? Usually, ODB auditors will only look at current frequent dispensing forms to make sure they're up to date. But in some cases, they can ask for previous year's forms as well. So it is important that pharmacies have all forms updated each year and they are scanned and or filed in an easily retrievable format. For med checks, do auditors look at the quality of the med check or just that the form is completed and signed by the patient? ODB auditors only look to make sure the documentation requirements for med checks are met. An ODB inspector will not look at how thorough a med check is or whether all drug therapy problems have been identified. For medications that have an ambiguous day supply, is there an ODB limit? For example, a box of Xalatan can last a patient 1 month, but another patient can go through it in 10 days due to several drops falling outside the eye. Is there a limit on how many bottles of Xalatan, similar drugs, ODB can cover without being subject to clawback? In general, ODB will calculate days supply based on the directions of use. If the patient is using Xalatan, 1 drop in each eye daily, then a bottle of 2.5 mils, which has 50 drops, should last 25 days. Having said that, if a patient has dexterity issues and is using more or using it up quicker, that is acceptable to ODB, but it is important the pharmacist documents that information on the hard copy. Are early refills by a few days a big deal? For example, if a patient is getting several meds refilled and they want them all at once, but one is more than 10 days early, for example, 78 days out of 90, which is considered an early refill by ODB, is that an issue? Is it sufficient to document the reason for the early refill? As long as there are valid and reasonable explanations, and they are documented on hard copies, then ODB is usually okay with that. For example, if a patient is 1 month early on their chronic medication, but next time they are 1 month late, then that is totally fine. Even if a patient loses medications and needs a replacement, that is also fine as long as it is properly documented. If there are reasons like synchronizing meds or getting refills a few days early ahead of an expected snowstorm, that is also considered okay as long as it is documented. If there is unusually high proportion of early refills at a pharmacy, then the ODB software may flag that pharmacy for a claims review. How do you handle a situation when ODB guidelines are outdated? They don't meet the current clinical guidelines. LU codes and criteria are currently being reviewed by ODB. For EpiPens and allergy shots, do you need an allergen special authorization form? You no longer need the allergen special authorization for EpiPen, but you do need it for other allergy shots, such as customized allergy shots prescribed by allergists. Some private third parties contact patients directly during audits to ensure medications were indeed dispensed according to what was billed to them. Does ODB contact patients or prescribers to verify that a medication was prescribed or dispensed? It's not common practice, but it can be done if deemed necessary by the auditor. If a pharmacist isn't happy with the outcome of an audit, or they feel they've been treated unfairly, is there an appeals process? Yes, it is outlined in the letter you get from ODB at the conclusion of the audit. Disclaimer, many of the decisions and courses of actions in an audit are subject to the discretion of the ODB auditor, so the same situation may be handled differently by 2 different auditors. This presentation covers certain but not all aspects of the ODB audit and does not serve as legal advice. For personalized legal advice, please consult your lawyer.